I wanted to ask the panelists and probably Dr. Steinberg, not for a political answer on this, but we talk about the rectal examination, which is every man's favorite exam, and the PSA. Do I need both? Can I have just one?
Right. So everybody's afraid of the rectal. Nobody enjoys it, and I get my digital rectal examination. This is the digit here. If somebody hasn't had one, it has nothing to do with computers. This is the digit. In my practice, it's important to do the digital rectal examination. I have found men with early stage cancers who have an abnormality. I can feel the prostate. So that apple, you can only feel about 40% of the rind of that apple. The rest of it, the doctor can't feel. But if I do feel something abnormal, even if the PSA is normal, that may indicate that the patient needs a biopsy. So it's still the recommendation to do both. And it's funny, the other day I had a patient come in and he said, doc, I know you told me you felt something abnormal, but I want a second opinion. So I examined it again, but I used 2 fingers. So I don't know if people have heard about that. But
Well, I agree with Jeff, but you got to realize something. By the time I send a patient to a specialist, a urologist as Jeff, he needs a rectal exam. There's a reason why you went to see the urologist. Now, I'm a primary care physician, like I told you, internal medicine. I'm going to tell you this much. If somebody walks into my office and said, doc, they tell me I'm supposed to have a rectal exam, I'm not going to say I'm not doing it. But if it's going to scare people away from coming in to get their overall health evaluated, it is not something that I'm going to push. In the course of my examination, taking a history, etc., I discover that there are symptoms or reason to convince this person to do a rectal exam. Yes, it is part of my examination. But I'm not going to let it exclude me doing a total exam on that patient if he says, look, doc, I don't want to finger up my own. I'm like, okay, well, let's talk some more. Let's develop a relationship. And some point in time, maybe we'll do it. But hey, listen, if you're due for your colonoscopy, tell you what, you always get a digital rectal exam just before we stick the scope in. So I'm going to get it anyway.
The other thing the thing I think that's important is what is, and perhaps I should ask it more scientifically, what is the positive predictive value of a DRE? In other words, a negative digital rectal exam means what?
Okay. I'm going to speak like Clement from the primary care doctor perspective. Again, for urologists, this is what they do. For primary care docs like Clement and myself, it's a tiny piece of what we do. And in our hands, the digital rectal exam, to be honest, related to prostate cancer, is almost worthless, at least for very early cancers. We're just not very good at it because it's not something that we do. I mean, it's something we've been told, you do this on a patient, but in terms of actually being able to find things, now occasionally we may feel a lump or a bump, but because we say that your prostate feels normal to us, in no way, shape, or form rules out cancer. So from the standpoint of American Cancer Society's perspective, whether or not to have it done is just as Dr. Rose said, it's between that patient and his doctor as to whether or not he wants to have the digital rectal exam done. But if a man wants to know, he wants to be screened for prostate cancer, having just the blood test alone, we view as a reasonable approach to screening because we don't want that digital rectal exam to stand between that man and getting the information he might want to know.
And that's why even in things like this, we've moved away from doing both. That in large screenings, we move just to doing PSAs because most cancers these days are found because people had an abnormal PSA, not because they had an abnormal. And just to go back to your exam, if this was the whole prostate, when you put a finger in the rectum, you're only feeling that much. That's all you feel is about that much. So you don't know anything about this over here, up here, over on the side, or any of that. It's all you feel is this much.